It's only a mother could love.
Oh my goodness. Okay, let's get into this. So, believe it or not, you had a boatload of good changes.
I'm not surprised at all. I'm serious. I feel 1,000% better.
Well, we have 18 at least improvements.
Wow.
And it's good because of the perspective of what you came in with. And
I'm a little disappointed. I don't see my face anywhere.
we can put it on there.
I'm sorry. I'm not any help at all.
So your wellness score went from 297 up to 316. That's kind of dramatic. Microcirculation, which is super important, went from 71 to 74 because ultimately when you go, so your heart pumps blood out, aorta, and then out to your body, then, you know, ultimately to get your nutrients, oxygen into your tissue cells, microcirculation. So that score improved. Body composition went from 85 to 89.
What does that mean?
So you lost like 3% body fat was the key. So body fat percentage 25.4 to 22.7. So that's
What's
good.
considered good?
Well, ideal for guys
Yeah.
like 20%. You're like
Okay.
super close anyway.
Okay.
So
Okay.
vertebral score, I didn't put that down. That's nice.
Okay.
That dramatically improved too. Cardiovascular score, it was low poor range. Doesn't
Right.
if it goes below that, you're not here. You're present with the Lord. So it went from a 10 to a 16.
Oh.
So it just kind of tells us that we're on the right track.
Right.
So
Right.
your systemic vascular resistance, the overall tone or tightness in your blood vessels relaxed a bit. So that came down nicely. Want it to be better. It's not perfect, but it's definitely better. Stroke volume, the amount of blood your heart pumps out each heartbeat, better. Cardiac output, the heart's strength compared to how much output it can give your body as far as blood content. Blood volume's better. Cardiac index is muscle strength, heart muscle strength combined with oxygen demand. That's better. Stiffness index has to do with heart work and muscle tightness because the big thing is if you have tightness in your blood vessels, and you've heard of hardening of the arteries kind of thing. A little different here. This is the tone of your blood vessels, which tends to be controlled by your nervous system. So calm down. Good. It's getting better. Nicely. Left ventricular heart strength. So your heart is actually stronger. Why? Because it is a game of missing nutrients. Give your body back what's missing, and all of a sudden it starts to work like it should. I mean, it's kind of a funny concept. Everybody sort of, well, not everybody, but knows that that's true. But then when we can prove it, like a before and after with objective testing, it's really pretty cool. And this is what we get to see all the time. Both systolic and diastolic blood pressure actually was lower compared to your first time.
Okay.
Still needs to be a heck of a lot lower, but I'll tell you why that is in just a minute too. Insulin resistance decreased. Pancreatic function, organ system measurements better. Stomach's better, liver's better. Lots of good things there. And so, since we have so much to cover, I thought we'd kind of give you good snippets, but still, well, let's go over the scan result.
Okay.
I think we did Menla scan. And that must be you right there. There's your 316. Your body composition is a good score. Microcirculation is in a good range. Now the cardiovascular, I think the biggest difficulty for you, the most, I think you probably are the most obvious patient. The most obvious person on what's wrong. It's your heart. Plain and simple. Now, we also have some really juicy information over here too, so this is going to be good. But you look at everything else. Microcirculation's good. Vertebral score, moderate. Comparatively to what it was, much, much better. But your cardio score went from 10 to 16. That's a good thing. Autonomic nervous system's in a good range. So you think about it and you go, well, you don't look bad. You don't feel bad. I mean, you can do things that you want to do. I think endurance was an issue for you.
Mm-hmm.
And there's a reason for that. We're going to talk about that over here. But, I mean, you look at your body composition, 22.7. It says it's normal range for your body fat percentage. That's the real thing that only matters in body composition is your body fat percentage. Doesn't, because BMI doesn't take into account your height and weight ratio. I mean, it takes that into account, but it doesn't take into account your frame size. You're a bigger framed guy, so it would always look like your BMI is out of control, which is why we don't like to use that, because it's not a good number. So, good news there. Here's your microcirculation score. Went from there up. It's improving nicely. You're in a good range. I mean, not in a poor range. Good range.
That's not a long period of time either.
Yeah, 6 weeks. I mean, wow. So the worst is heart, cardiovascular. But 10 to 16, that's a pretty significant shift. I'd like to get you up into the moderate range, and then, of course, good, and which is all doable. All doable.
Does high repetition exercise help that for your heart?
Not so much. This is really, really specific for you. Basically, what I should do is cut to the chase. Are you up for a challenge?
Are we going out to breakfast?
That's good. That's good comment. This test was probably the best test that you could have ever done. Period.
That's the CT scan?
It's a CT scan. So, you ready? Okay, we're recording this now. I have a CD for you.
Okay.
You could take it home and look at it if you want to, but the big thing is in the report. So this is measuring the calcium content in your coronary arteries. And if we let this heart turn around here, and just to show you. Right. Almost. There. Okay. So, this is the right side of your heart here. So it'd be like you're facing out this direction here. And this is the left side of your heart. Left side is the side that pumps all the blood out your aorta and down and out to your body, your entire body.
Okay.
So, the scoring on this is, okay, so how much calcium content is in your coronary, those arteries that really supply your heart muscle. That and right on that side. That's the right, that's the left side. So the scoring is, it's called an Agatston score, to whoever made up this level, or this.
Is that the guy that discovered it?
No, he has some parameters. So that's okay. And basically, the range, I'll give you the exact range, just so you know. Here we go. 0 is no identifiable calcium. 1 to 10 is minimal identifiable calcium. It's a hard word to say, identifiable. 11 to 100 is mild calcification. 101 to 400 is moderate. And then 401 and above is significant calcification. So, those are the ranges there. So on your findings, basically, it says that your score, the top there.
I don't have my reading.
Okay, 891. 800. You're above severe. You're
okay.
An oh my gosh level of calcium in your coronary arteries. Now, I don't know. Did you ever see that movie, The Widowmaker?
Yes.
Okay. I'm not sure if you remember the details, which is okay, but there's 2 main coronary arteries, which is like the trunk of the tree, and then you have branches off of it. And the Widowmaker is called the left anterior descending. Okay? Mm-hmm. Because if you have a blockage of your left anterior descending artery, which feeds the left side of your heart, and you happen to have a heart attack because of that one, you will be present with the Lord. It's like not a good finding. You don't want to have that one blocked. So, that being said, you're finding 3-vessel coronary artery calcification identified most prominently within the left anterior descending artery. You did this about as good as anyone else could do it. I mean, I couldn't even make this up. So the left anterior descending is the Widowmaker is definitely blocked. Mm-hmm. And it has an oh my gosh level of calcium, so guess what we need to do? deplaque your arteries.
Okay.
There's two pathways for you to go. And this is something to chat with your wife about, since hopefully she'll hear this. You could go, if you went to a cardiologist right now, unfortunately, and if you saw that movie, cardiology doesn't use this testing. Why? The only reason is because it's not lucrative. It's not going to make them lots of money. So, I'll just cut to the chase. I was going to tell you a story about a guy that we did this with, and he actually listened to me. He did the testing. Same thing, horrible calcific plaque in his arteries. Said, at that time, this was like 15, 18 years ago. I said, get to a cardiologist. I didn't know all that I'm doing now. I didn't do the stuff we're doing now. Get to a cardiologist. He goes there. The guy says, it's a bunch of baloney. Here, do my stuff. We'll take care of you. He's going to put him on a bunch of drugs. I said, get a second opinion. He did. The cardiologist immediately scheduled him for open heart surgery. Saved his life. He's still alive today. That being said, the reason that some doctors wouldn't look at this, again, it's because it's not going to make them lots of money. However, this is real. I don't get why they would poo-poo this at all. I mean, this is objective proof.
It's all about the buck.
It is, but
industry is all about.
But you think that this would say, "Hey, I can do wonderful open heart surgery on this guy. He's got a terrible situation, the worst of the worst, right here. That's you, unfortunately." So the choice is you can go to a cardiologist, and maybe with your wife's input, maybe it'd be like, "Oh my gosh, yeah, I get that," or you could work on it like we're doing. And have more benefit in the sense of your full body's changing. Your full body is improving inside out, which is most important. As you know, there's not much we can do as we age from the outside in. I mean, we get gray hair and we get wrinkles and that sort of thing. But inside out is what's most important. And yeah, this is the stuff. This is exactly why I do this test. If we find, thank God we did this testing. Because you were like a time bomb waiting to explode kind of thing.
Now, what would cause that bad of a calcium buildup?
Nutrient deficiencies, seriously. And so it's not funny, but it's interesting. I always could blame it on God, but what we chose from that other test that we did, right? The HSR, the heart sound recorder. What we chose on there was almost exactly what we should have been doing anyway to deplaque your arteries.
Okay.
And imagine that you could deplaque your arteries completely. Probably with this much calcium, it might take you a couple of years or so. But to be like low on the scoring and maybe have none at all.
It's pretty confident that we can do that.
Not only confident, absolutely. 100%, because first off, you're the type of person that gets this. Secondly, to me, it's the only real solution, because classically what they would do is they would go and put in some stents first, because one stent is $30,000 to $60,000 to put in, which doesn't fix the cause of why it happens in the first place for you. Does not at all. Then they would probably do bypass surgery, and that's like
and you just start over and start building it back up again.
Well, yeah, it doesn't change the reason that it's there in the first place, which is the problem. So, and I'm telling you that, well, maybe you've had friends that have had open heart surgery, bypass surgery. It's a life-changing event, and you would be on major medication for the rest of your life, and so to answer when you threw out that first question of like, what can I do to build up my heart muscle? Well, first, it's not so much of a building up in this. Well, it is in certain areas. So, for instance, B vitamins are critical for heart function, cardiotrophin critical for heart function, heart strength of contraction. Specifically, the vitamin B4, which is in this new, I didn't even tell you about this, but it came out. They came out with a new Cataplex B. It's called Cataplex B Core, and it went back to Dr. Lee's original formulation back in the 30s, I think. 20s or 30s, and it has a whole bunch more vitamin B4, which is the critical key to dramatically improving heart strength.
Okay.
All muscle strength, B vitamins. You typically wouldn't go there, but it's true.
Mm-hmm.
Why? Because we see it every day, all day on the HSR. Before and afters, like you have this terrible first sound. The first sound is supposed to be this really tall boom,
Mm-hmm.
boom,
Right.
and when it's all smashed down and spread apart, that's not good. Give the Cataplex B core back, and boom, almost immediately, like within 10 minutes, you get this massive, great heart
So
contraction.
we can order that through.
Oh yeah. That, in other words, and we're gonna move to the solution side of it in a few minutes, but I wanted to really get you to understand this because, you unfortunately, thank God you're who you are, and you kind of, I hope, you're taking things the right way. Some people will be absolutely freaked out, and I wouldn't see them again. They'd go to their cardiologist or go to their doctor, to a cardiologist, and they'd
Yeah,
be
it's not gonna
heading down
happen.
that pathway. That's not you.
That's not going to happen.
But I'm saying the worst thing you could do is have massive stress. Have stress that really upsets you. And I don't know if you are that kind of person these days.
No, not really. I mean, the most stressed I get is when I would be worrying about Nathan.
Yeah.
And his health, that kind of thing. But no, I'm just, I am, like Paul said, I am what I am by the grace of God. So it's whatever He makes of me, that's what I am. And
Yeah. Yeah.
I can't do anything else about it, any of the other things anyway. So
Well, and so, I think what we haven't done is we haven't specifically charged up your heart. We didn't put the energy directly on your heart. And
well, what deplaques the arteries?
the Saruta Plus that you were doing,
Okay.
we want to switch that one up. And here's the thing. We want to get a kind of a count on what you think you have at home for those nutrients. I think you probably, didn't you recently get some more?
Yeah, you had me add 3 other ones that you said were temporary until we do this test, and those one's gone, and the other 2 are almost gone. But the other regular ones that the colonel gave me
Nice. That's good.
all of these other ones, she still has me taking.
Okay, yeah.
She just keeps ordering them. So
Okay.
that was her big question, is she wanted to know, do I stay on the same things and the same amount of them, or are we going to switch up how much of each one I take, or are some going to drop off and new ones come in?
Yes,
She's
and
like,
yes.
You make sure and ask me those questions. I need that, and if you can post that, so we can down that. But
Well,
yes, Colonel.
and a couple of things too that additionally that I'll do is I want to take you out put you on the table. I want to throw these on you to get so ridiculously specific. There's no guesswork at all, but there are some things to change up, some things to take away, others to swap out, like the Saruta Plus, to move to the Saruta specifically.
Do I finish off the ones I already have?
I would, yeah. I would just definitely do that. The biggest thing, well, not the biggest, but a big thing too is I don't want to overwhelm you with too much stuff to do. I kind of do and don't, but I want to make sure we do overwhelm you with exactly what you need to do this deplaquing process.
Okay.
That's plain and simple. That soybean lecithin is a critical one. The Saruta is a critical one. The cardiotrophin and the Cataplex B core. I didn't do that the first time because first off they didn't have it. Now they do. But it really dramatically improves heart strength of
Grace hates
contraction.
that soy lecithin because she asked me to put them in those little containers for one, for each day, and those are like kind of slimy.
Yeah.
So she's like,
Are you busting them open or are you
no, but they get kind of a
kind of a
film on
sticky?
them.
Yeah.
So she's like, they're washing her hands, and I'm like,
And that one is amazing at restoring cholesterol levels, at helping your liver to process cholesterol better. Because I would say, plain and simple, the 3 major systems that you have issues with: heart, of course, liver, and brain. Liver is because it processes gosh, your hormones, but it processes cholesterol. It makes over 90% of your blood fats, your cholesterol levels. So therefore, if you can help it out so that you can actually process that better, plus it filters your blood, hence blood pressure can be affected with the liver. So there's a lot there, and if I could condense it down to the major things, those are significant players. So I'll show you as we go through this. And we'll go through this a little bit more too, the report. We'll go through that afterwards. I want to kind of go through this because
I stay on a keto friendly diet.
Yeah, it was interesting too. I told you that I took your HSR to that group that I belong to, and this guy, he's actually evaluated HSRs for like 49 years.
Wow.
So he's a master at doing them. So I put in what I'm doing, and then he might give me a little bit of extra fluff and tweak and fine tune. Mm-hmm. That's kind of what he did, which is really nice. But we were definitely on the mark, you and I, with the right stuff. It was just kind of tweak and fine tune a couple things. So, yeah.
Is there anything big to stay away from as far as eating?
Yes, and that was the right point. Sugar and starch. Okay. He says that's the crux of this problem. Period. And he says, is keto as you can keep it. If you can make sure that you're less than 20 grams of carbs a day, that's kind of my thing. But even so, sugar and starch will destroy you.
Yeah, I don't eat potatoes. I don't eat rice. I don't eat any corn products. What else? Pretty much anything that's white, breads, grains.
Mm-hmm.
Any of that. So I don't eat any snacks. I don't eat any chips. But I was I used to take in massive amounts of protein for heavy weightlifting. Mm-hmm. But as far as starches and sugars, I was raised on that.
Yeah.
Anything we had to eat was something with potatoes.
Yeah.
And always a lot of tons of chips.
Mm-hmm.
And sugars. I mean, I have a sweet tooth. I eat tons of that stuff. Since I was just a little jeter.
With you. I mean, same thing. Raised. I mean, pizza and French fries and all that stuff.
Oh yeah, lots of French fries.
Wow.
What a great invention. It's made the cardiology world a fortune.
It has. Oh my gosh.
Have you ever seen that guy that has the restaurant? It's called the Heart Attack Grill.
Yeah. Yep.
And he used to be like, what was he? We used to work like in the health food industry or something. And he said, I just got tired of telling people all this stuff that they couldn't eat. You have an all-you-can-eat French fry bar with the food.
Yeah, and the French fries are fried in lard.
And if you weigh over 400 pounds, you ate for free.
Wow.
Insane.
Oh my God. What if he gets money from the cardiology?
Yeah, he probably does.
Wow.
He has stock in Kaiser Permanente.
Let's see, what else can I show you here? Over here. Okay, so under disease screening, there's some cholesterol. Still need some work on that. Diabetic screening, everything come down, boom, which is good because that means that you have actually taken carbs out of your diet. So your markers there were awesome. Interesting. Chronic hepatitis markers or risk factors. HEPA is liver, itis is inflammation, liver inflammation.
Okay.
Don't know why that marker was low before, and now it's kicked up to the top end of normal. But, okay, so. Don't know. Maybe by happenstance. I mean, I have no real good explanation for it. By the way, too, your prostate seemed to be good. Do you know? Is it good, your prostate?
Yeah, I've never had a problem that way.
Okay, God bless you. Good. Because when you get over the age of 50, you start having those issues. But you're almost there. You're almost 50, right?
64 going on 80. I do beet powder every day too.
Okay, good. Beet juice powder, yeah, good. Because there's hardly any carb in that versus eating beets. You'll get blasted by And that helps your nitric oxide, which is also reparative and protects your cardiovascular tissue. So that's really good. Serotonin went high. Dopamine was low. GABA was high. GABA remains high because it's trying to calm down that blood pressure, calm down your body internally. So it's
What about the dopamine?
It's a motivational neurotransmitter, also some happiness, but not so much worried about that. I mean, unless you were like massively depressed or something, but that doesn't look like you. Let's do this. Here we go.
Only when I'm at the restaurant and they say, "Oh, we're out of that."
You don't like that, eh? So the picture on the right is your before, that's the after. And what do we like? We like gray color in organ systems. So if we zoom in a little bit more, scoot that up a little higher. And I think you can see the difference there. Unless you're like me and can't see colors too well.
My dad was colorblind.
Yeah?
It's amazing the clothes he would wear together.
Yeah, thank God I have... My wife will yell at me if I were to do something like that, but...
Oh yeah, it was great.
So that's what I'm saying. Your stomach, your pancreas, your liver are better.
Well, it's interesting too because the statins and other things that I was taking from from Kaiser can kind of give you false readings of how your system really is because the stuff you're taking is kind of. So that's, to me, that's good news.
And the other downside to that stuff is sometimes I could concede that sometimes medication can be necessary in the interim just to kind of get it under control. At the same time, you're trying to work on the mechanisms behind it, why it's that way. Okay. But just the medications never solve it, ever. So if you're never fixing the mechanism, the foundational cause of why your blood pressure's high, why your cholesterol's skyrocketed, all those things, which is what we're after right now. In your case, this big, massive test that's so important. Now it's okay. Deplaque your arteries, save your heart. I mean, imagine if you did this. If you deplaque your arteries, then what? Well, I guess you just get old and you don't check out. I'm saying that because, of course, Jesus is coming soon, really soon.
Very soon.
So, I mean, yeah, you for the most part, you don't really have much to worry about. I mean, if you can, not if, it's, well, I'm saying if because, but you're the right kind of person. So that's a wrong word for you. It's, yeah, when you solve it all, you're going to be like excellent. And repairing and restoring artery tissue integrity, the walls of your arteries and how healthy they are. That's kind of important too. And that is a very specific type of vitamin C complex. It's the rutin form of vitamin C, which is a whole food form, but it's very reparative and restorative to artery tissue. Plus two, if you ever notice, if you floss your teeth, if your gums ever bleed, that definitely is a vitamin C deficiency. Is all that is.
Yeah, mine do.
Yeah. So enough of that Saruta, and in this case, you were doing Saruta Plus, but we want to switch over to Saruta.
Okay.
Enough of that, and you won't have the gums bleeding anymore.
And I can take the new stuff along with the stuff I'm already taking until I run out of whatever you...
You could, or you could just, for instance, you could do just more Saruta Plus if you have it, for instance, and then switch over to the Saruta when you finish it, kind of thing. Because again, I know you're a strong, big guy, but you can carry a lot of stuff, but we don't want to overwhelm you with too much stuff to do. There's your brains. That's what I was saying. Your brain still needs some work.
Oh, but yeah.
Well, but the reason why is it's still the doctor. I mean, there's no substitute. Yeah. That's really what heals your body. Let's see, what else can I show you? Neural network. This was all sorts of colors all down through here as well before, and now it's just up here. And it's interesting because right there is heart. The other thing too, up higher, which is at C6, C7, and C8, which is in your lower neck, those are actually high, and that's thyroid. And it's interesting. I was just educated this morning, like from this guy who's been in practice. He's 78. Anyway, he's been practicing a long time. The connection with mineral metabolism to thyroid. Thyroid definitely regulates, and also your spleen regulates mineral metabolism specifically. So supporting your thyroid and your spleen will make dramatic changes in being able to deal with you putting calcium in the wrong place.
Okay.
You want to stop putting it in your arteries. But foundationally, a root cause of that is the carbs. And
Okay.
we never like to hear that, because who doesn't love? I think we all love carbs. I don't know too many people that don't. Maybe if you weren't born in this country, but that's easily changed, right?
Well, oh my gosh, the thing. I used to read this stuff that not only Jack LaLanne would write, but other people in the health industry. It was just incredible how for years it's the salt, the salt, the salt.
Mm-hmm.
So they tell everybody to take up, but then when they took the salt out, they started shoving sugar and everything.
Yeah.
In massive, and it's just a game they play that's
Mm-hmm.
billions of dollars worldwide.
So, in conversation about this test, this was the interesting thing. He was saying, yeah, see all this baseline agitation in here. Obviously, he had recommended, instead of remember the Mintran, I think? Is that one? That's one that you're taking, aren't you? Let me just go through my notes here. He had suggested switching. Are you doing, maybe you're not doing Mintran?
Yeah, I am doing Mintran. I'm doing Mintran 3. Mintran, this just says -3, and then it says 2 times per day.
Okay. Yeah. So here's the change up. Then you're going to get printouts of all this too. Mintran to Minchex. Minchex is powerful. It really drives minerals into your tissue. That's the problem, is you've had a problem taking calcium from your blood and using it in your tissues. Instead, you put it in bad places like artery walls, which isn't good. So Minchex has some nutrients in there. I don't know if you've heard of hyaluronic acid. It actually will drive minerals into your tissues really well. The same thing with Cataplex F. So there's some change-ups here. Basically, this looks like a huge list, because there's 2 lists here. There's this list, and then there's this list that extends down into the next page, and you're like, oh my gosh. What I want to do is I want to test you on all of this and only choose what your body says yes to.
Okay.
And let me just kind of, if you follow my thinking on this, one of the ingredients or the nutrients that's important for heart function is CoQ10. You've already heard of CoQ10 before. Well, it's in a product called Cellular Vitality, and that typically goes in the recipe or the formula to deplaque arteries, but we'll see. Cod liver oil is a great fish oil that has naturally occurring vitamin D and vitamin A and some F. So it has all 3 of those. Vitamin F is Cataplex F that helps to drive minerals into your tissues as well.
Okay.
So I don't know. Basically I put the formulation that deplaque your arteries together and test it and see. Try K, because I only want to give you what you need.
Right.
Not 50 things, but just what you need. Tri-K is a product from a functional medicine company that I've used before, and it has all 3 forms of vitamin K. And the second form, which is called vitamin K2.
I take K2 now.
Okay. So the MK7 fraction of that also helps to deplaque your arteries. So interesting, if we would have done this scan when you first started versus now, I bet you there's a change. Why? Because you've had a lot of dramatic cardiovascular changes, improvements. So, but regardless, you might even want to bring that one in that you're taking, and let's test it on you and see how much you should take. This guy, actually, that we talked to this morning, he discouraged using K. He said because you need all of them together in a natural form, because one will activate the other. So K2 is activated by K1. So, and he said that they just, they've isolated it just to make money on vitamins. It's like, okay, yeah, that happens in the vitamin industry as well, So, but we'll check it on you, test it on you, and see if it tests for them. Magnesium. Magnesium's always a really big player for heart. It's also relaxing of blood vessels, dilates blood vessels, tends to decrease blood pressure, and all those good things. But I don't know. We'll see. It's also in the formulation to deep plaque arteries. So now thyroid support, again, for mineral metabolism, thytrophin.
I've been taking potassium and magnesium,
Okay.
and just one
Is it-
one a day though. So it's just over the counter stuff. So I don't know what the quality of the
Okay.
product is.
Well, I would bring that in and test it. Let's just test it. It's just because if we could take this much stuff and go that, that'd be great. That'd be better for you. Iodine, prolamine iodine. Your thyroid hormones are T4 and T3, and T4 is 4 iodines, T3 is 3 iodines. So iodine is foundational and critical for thyroid function, and thyroid function is affected and controls a lot of spleen function, and spleen function is mineral metabolism ultimately. So if you could never ever again deposit calcium in the wrong places, that'd be good, because you're also likely to form kidney stones and gallbladder stones, and boy, if you change all that, you don't put it in the wrong places at all.
I had kidney stones twice.
Yeah, so we don't want that. The Cataplex F is there just to test on you, and I put the Trica in twice. Let me delete that. Delete. So I would say these are the things that we want to test. It looks like a lot of stuff, but I want to test on you. But the real change up from what you're doing now is Cataplex B Core instead of Cataplex G. Min Chex instead of Min Tran.
Is that like wheat checks or corn checks?
Oh, no.
Because I could eat a bowl of those.
Oh, you're good. The soybean lecithin, because this guy was saying you need to do way more of that, like 6 twice a day, to really dramatically shift up liver function, but also your cholesterol levels.
Okay, so I think I'm taking
Three twice,
twice a day.
or maybe it was
I think
three times.
a day.
Okay.
Three times a day.
Those little pearls, right? Yeah.
So go up to 12 instead of 9.
And core, is Saruta instead of Saruta Plus. So that right there is pretty tight as far as this cardiovascular restoration stuff. The rest of this stuff is my experience on sort of my recipe to deep plaque arteries, and we've done it before. So there. So we'll test you on that stuff. Let's see, what else can I show you? Oh, so this test right here. So you want I don't know if you remember this, but you want a large first sound, small second sound, and you want these nice flat bass lines between. So if you look at that, and your mitral valve is the critical valve it's like central of heart function. And so you go, well, gee, why would it look like that? You kind of go, where's your first sound? Maybe that's your first sound. Maybe that's your first sound there, but it's got all this blah, 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 blah. Probably because of not being able to push blood through those vessels well enough. So you're getting backflow, back pressure. Down here, tricuspid valve is also central to heart function, but it looks better, right? There's first sound, there's your second sound, first sound, second sound. Now down here, this is perfect. Perfect in the sense of it definitely, we can see why now. Your aortic valve, when you have a large second sound, consistently, large second sound, large second sound, large second sound, that's because of circulation, and that's why the soybean lecithin is so essential. But now, doing this test, we really know why you don't get enough circulation where you need it, and hence the comment that you make about endurance fits. I mean, certainly your body's smart. God's design, He built around collateral circulation around the blockage, but still, I mean, you don't want to mess with that one. You know, you don't need that all of a sudden, that dramatic, shocking, surprising stress that your body goes into stress mode and kicks in some adrenaline and your blood vessels tighten down and you don't have good circulation in your heart and you're going like, you know what? You don't need that. So I'm saying, man, not that you don't, but trust in the Lord, right? With all your heart, lean not onto your own understanding. And that's you, though. I mean, I do. I really, I don't know. I haven't known you that long, but you definitely are that easygoing, yeah, whatever, kind of perfect. So.
Yeah, only when I watch Fox News at night do I get upset.
Oh my goodness. Yeah, like these two cops in Compton. Those people outside of the.
Laughing at them and saying I wish they'd have killed them, and getting in the way at the hospital and not allowing this.
Exactly.
It's just
That's awful.
I was an officer on duty, I don't know that I could have just stood there and I probably would have lost it.
Hmm.
Those guys would be in the hospital right behind those two officers. That's just.
Or they would have been in the morgue. I
Or
mean,
in the morgue.
oh, I know. That's the thing is I've been finding myself not being very Christian-like in my thinking and.
It's a wrestling match because this is over the top. I mean, you can have righteous indignation, but yet Lord says, "Vengeance is mine."
Yeah.
No, even though I pray and ask Him that I could be His tool
Mm-hmm.
For His vengeance, but it's getting harder and harder.
Yeah, it is. Oh, yeah, it is. This testing here, this is the heart rate variability test to measure the autonomic nervous system control of heart function. And it's interesting. You were down here. This is just the laying down, standing up part of it.
Mm-hmm.
So you're down here. So I'm trying to think of what we had you on before. That our goal was to calm you. Maybe, I mean, also if you said you have a supplement that has magnesium and potassium.
No, I take the two
Okay.
individually.
Okay.
Potassium and magnesium.
Because the fact that you're below the line on your stress nervous system,
Mm-hmm.
Typically we see that with people that are on beta blocker medication. It's a blood pressure medication, but what it does is it decreases your sympathetic nervous system, and hence relaxes your blood vessels. Well, you're already below the line. You're down at a -2, and then when you stood up, it kicked up to 1, 2, 3 points when you stood up. Like standing up, typically you would think it's not that stressful, but it was for you. Your sympathetic nervous system kicked up 3 points to compensate for it.
Could that be because of the poor circulation, because of the plaque buildup?
Could be, but my point is that you're below the line to begin with, so that means that something is calming you a bit too much. Well, and so that's what I'm saying. Maybe the classic one that typically does that is potassium. So maybe set the potassium aside for now and just do maybe magnesium. Magnesium, if you do too much too, it can also loosen your stool, so you can get some diarrhea. I don't know if you've ever had that.
I have off and on, but for different reasons.
Okay.
You can only eat so many pork enchiladas.
I circled this twice: bigeminy and single extrasystoles. Double extra beats, single extra beats. That's all this stuff going on here. So, liver shows up 555, 284. Ideally, it should be below 100.
Okay.
So again, that's just confirmation that liver, heart, brain. Health marker, not too shabby. That's the top left's the best you can be. Bottom right's the worst you can be. You're there. As far as adrenal gland, your stress gland function, the top is the best adrenal function that you can have. That's the worst, and you're impressive, pretty close to the top. This Valsalva test, you're still in that red zone, that severe nerve system problem zone, but I think part of it is the fact that you're down here with too much potassium. You need less of that so you can be here. If your reaction was here going up to here, it would be better. The number would be better.
Yeah, the reason I started taking that was because my muscles kept knotting up
Yeah.
real bad. So I was increasing that. And that's subsided, except I still get ab muscles that will knot up and they won't come undone, and it takes a while for it to get it to relax.
Well, and that's interesting. We had this discussion this morning about this very thing, and it's calcium metabolism problem. So, classic, you think, well, okay, if it's not enough calcium, give you more calcium. Well, you have too much calcium, so it's not so much the amount of calcium; it's if you're able to put it into your muscles, and that's the problem. And that's a Cataplex F. That's basically an F.
Aren't I taking that one? Yeah, I'm taking Cataplex F, 3 of them 3 times a day.
And that's really essential then to then stop the spasms, the muscle cramps. Yeah.
Okay.
In some cases, we have to do the combination of calcium as well as Caplex F. But in your case, you already have too much calcium. Putting it in bad places, it's just how you're using it. You need to put it into your tissues and use it better. So, yeah. Let's see. Confusion. Any thoughts? I mean, we've dumped threw a lot of stuff at you.
Well, yeah, I wasn't that smart to begin with. So, there's only so much little process, you know.
Well, we got it all recorded too, which is good.
I don't have that big a hard drive to start out with.
So what I'm going to do, though, is I'm going to take you out. We're going to test all this stuff on you right here and make sure. We're going to refine it down and say, yep, this works. Oh, that doesn't. Because if we can make that easier, hey. Your magnesium, what form is it in? Is it in a tablet?
It's a pill.
Okay. Because we have this stuff called Easy Mag. It's in beet juice. There's a beet juice powder in there. But a lot of food-based magnesium you do a little packet of it in a little foil pouch and dump it in some water, stir it up, and boom. Kind of tastes pretty good, actually. But that's another way to get enough magnesium in your system. That's really good. But like I said, I will test you on all this stuff. And I'm going to hit File, Print. Let's see. Make sure it's going in the right direction. Yep, it is. Hit Print. So, now more back on the heart scan test. So your Gadsden score is 891. Let's see. Number 2, cardiomegaly. I don't know if you've ever heard that term before. Your heart's too big. Your heart's getting larger. Why would you have an enlarged heart? Because it's working so hard.
Okay.
It's working harder because of you're not getting enough blood to it, so it has to work harder.
So, yeah, you want it to be that way spiritually, just not physically. Yeah. Okay.
And I think that's correct, actually.
Mm.
Fits both ways. Small, right, middle, and lower lobe pulmonary nodules. You have some sort of like little nodules in your lung, up to 6 millimeters in size. If the patient is at low risk for lung cancer, then no follow-up is needed. If the patient is at high risk, for example, the patient has a prior history of smoking, then consider an optional follow-up with CT in a year for reassessment.
I haven't smoked since I was a teenager.
Okay. But you did once upon a time?
I was a teenager. Grade school and junior high.
Well, and regardless of doing we'd want to do a follow-up to check your calcium content. So if we see that those nodules don't change, great. Moderate hiatal hernia. I don't know. Do you know that? Do you have a hiatal hernia?
I don't have a clue.
Okay, so where your stomach and your esophagus come through your diaphragm, there's a little bit of a hernia there, and so therefore you could actually have a little bit of indigestion or acid reflux as a result of it, but you don't have those?
Not at all.
Good. So we don't even think about it, don't even worry about that. And colonic diverticulosis. So your colon's got some outpouchings. It's not as happy as it should be or could be. Where is it? The thing I was going to tell you. Aneurysm of the ascending thoracic aorta with a diameter of up to 5.3 centimeters. Incompletely imaged. So that just says a weakening of your artery wall. How are you going to fix that? Lots of this good Saruta Plus, or Saruta in your case, that's going to be that reparative, restorative stuff for you. So how did you damage it? How is it weak? Why is it weak to begin with? Well, that's because of carbs, sugar, and starch intake. Not age. It really is not age. It's
the American diet.
Yeah, absolutely. That's why it's the SAD diet. It's a standard American diet. And but the thing is imagine this: you're taking the cause away. You've taken the cause away. You're not doing sugar and starch, and then secondly, you're putting back what's missing. which is reparative and restorative to your joint tissue, connective tissue, muscles and tendons, plus vascular tissue. Anywhere you have connective tissue and skin, it helps. The Cerruta does. Cerruta Plus. So, one thing to take away also is the Cataplex ACP. You don't have to do that anymore. But again, I'm going to test it on you and just to go like this to you. Not doing 50 things, but doing some significant things.
And I can finish those off.
Yeah, oh yeah, absolutely. It's not like you throw them out because they're all really, really good stuff. It's just that there are some way better things to do. It's kind of like a good, better, best in this case.
Mm-hmm.
You know, we're moving towards what's best now, because what you've been doing has had some really dramatic improvements, some good, really great changes. So I have no complaints. And you look good. You sound good. I mean,
yeah, I feel great. I mean, I still wish I had more energy for sustained amounts of time, but other than that, I feel way better than I did a couple months ago.
Well, imagine too that we can say, if in fact your thyroid is involved, that can also be an aspect of energy and endurance. But also too, just because the pump has been struggling to work.
Mm-hmm.
Why? Because of it's so blocked up. I mean, it's so with the plaquing. But you can very well deplaque this thing, turn it around.
That's what we'll do.
If that's your choice. But you totally.
No, that's exactly what I want to do. I don't want to go to. I'll put it this way: at the end of the year, December, I'll be 65. So we will go back down to the Union Hall in Pasadena, and I will do my thing to sign up for my Medicare supplemental thing.
Yeah.
So we're going to switch from Kaiser to what Grace's mom has.
Yeah.
Which is CareMore, which is now owned by Anthem Blue Cross.
Yeah.
Unless it's emergency medical, I will never go back to Kaiser again.
Yeah.
Not only of my own family's horror stories, but the ones I'm hearing from. Well, I have a good friend that's one of the head IT guys over at Loma Linda, and he's heard all those same stories, and he's like, yeah, it ain't looking good. It's just become a meat market.
Yeah. Oh, yeah. So I got two of these. I will keep one of those, which is that's the 2-pager report. You got another report that came with the CD. And the other thing too, I mean, just to give you some perspective on this, so it also gives you a scoring of what they call coronary age. How old are your coronary artery vessels? You ready for this? You sitting down? No, I don't have my glasses on either, and it's because I don't have glasses, and I probably should, but I can squint a little bit. It says that your coronary age, as far as your arteries right now, is greater than 90. Well, because they're so bloody blocked. I mean, and the worst you did. I mean, you chose the worst of the worst. Not that you chose it, but I mean, you know what I'm saying. And I'm hoping that your wife doesn't freak out too much. I pray that that's the case. That's not that she doesn't do that. Oh my gosh, because wives worry. I mean, guys, she loves you. What a great thing. But in the bigger scheme of things, I've never seen a good outcome with doing open heart surgery. It's very, very, very much life-changing.
It is permanently life-changing.
Yeah. You are never the same again. And also, give that to you. It never doesn't solve at all the cause of it.
You're just going to, in a sense, start over.
And what they would do is they would try to freak you out and scare the daylights out of you. That, if you have you're going to have you're going to, and we need to prevent that. Well, okay, that's somewhat valid, but they're trying to scare you into doing the surgery.
Well, yeah.
Yeah. And in your case, you're not that tight. I mean,
the one thing about Grace, very similar to Tanya, is whether she would freak out over something or not, her main objective always is, okay, what do we need to do? And that's what she's done with her mom, for all of her mom's medical stuff over all the years. It's like, okay, what do we need to do?
Yeah.
And what do we not need to do?
Yeah.
You know, and so it's always just going forward.
As long as you're working the plan, you have a plan that makes sense, because they don't have to get all into, you know, left anterior circumflex and all these technical terms to just confuse you and make the doctor look like he's smart. Who cares about that? Common sense always applies to healthcare, because when you can't make a common sense argument that by doing this you're going to get this outcome, the outcome that you like would be there's no cutting involved, you have all your same parts, and they're all cleaned out and clear and everything is fine and you're feeling fine, you're functioning fine, blood pressure's good, liver's good, cholesterol's good, it's all good. That's the bigger plan. And when you can show a pathway and an approach that will get you there, great. If it doesn't make sense, then it's sort of like someone with a spinal problem. Their spine is just destroyed. It's all crooked and bent and twisted. And they just give an epidural, or they just give medication. Would that be like smashing your car up and then just putting a paint job on it? No, it needs structural work. So it's like, or calling a plumber when you need an electrician kind of thing. You know, that's the whole thing. It needs to just make common sense. In this case, ketogenic diet still. I definitely would recommend that still. And, you know, hey, go revisit these. Go look over these, and if there's anything, any particular part of your day's diet, whether it be breakfast, lunch, dinner, or snacks, that you'd say, yeah, you know what, I need something extra for lunch or for whatever. Good, let me research it and find some ideas, some thoughts, just to kind of spice it up a little bit, to make you go, oh yeah, hey, this is good. As opposed to, I had a guy last night that also rescanned and we went over stuff. No, we just rescanned him, that's right. And he said, yeah, I did it really great, like the best I've ever done it for 5 weeks. And he completely blew it on week 6. It's like right before his scans. I'm like, really? But it was that same thing. It was like he got kind of bored with it, and okay. Now you have every real great motivation on the planet to do everything right, and I think you were the right person. You're not the person that I would have to worry about. That's just high strung, freaked out, scared to death.
Tanya's dad is one that is not. He's not stuck to his diet at all.
Yeah.
He's gonna have problems. He'll end up back on insulin.
Yeah, and all the while, see now, there's a perfect example of someone who definitely should do the heart scan.
Mm-hmm.
Maybe if we can find a place back there for him to do it. But
I don't know if he would.
That's anybody with blood sugar issues. And the thing is, today, 1 out of every 3rd person is pre-diabetic. So everybody should be doing it. I did my scan. You know, everybody should do it. And you know, the great thing about that too, doing my scan, is I guess what I've been telling people to do is correct, because I don't have any plaque. Yeah. Thank God. So
and they can't wait to get people on insulin.
Oh, I know.
That's just an automatic.
And it is so destructive. So destructive.
Automatic moneymaker.
Yeah. And the lower you can keep your insulin, glucose, blood sugar, and then cortisol, the slower you wear your body out from inside out. But the problem is most of us who've I've done the standard American diet too. Thank God back in the day, it wasn't so recent. It just does. It just destroys your body from inside out. So.
Well, we've become a nation that just lives for pleasure.
Yeah.
And so, in every way, shape, and form, it's whatever makes me feel good instead of whatever is right.
Right.
And so, that's where you get the immorality. That's where you get the TV screen just loaded with garbage food and drink and it's then when they run out of things, they recycle it. So now they're coming out with all the new canned drinks like they had back in the 70s.
Mm-hmm.
You know, they start mixing up all these sugary wines and all that. They're pumping that stuff out now again like it's some new thing. And
yeah. Oh, here's something. Just think about that. Do you ever go to Costco?
We used to go fairly regular, but the one up there was so packed all the time
Oh,
that
yeah.
we rarely go anymore.
Just they have this product that I started to use because I looked at it, evaluated it, it looks pretty good. It's by a company called Vital Proteins, and it's water. It comes in these tall, skinny bottles, but it's collagen water. One little bottle of it, and it has filtered water, slight bit of fruit. That's not like chunks of stuff, but just the essence of it, and collagen protein. So it has maybe 5 grams of carbs, but it has 10 grams of protein per bottle. I'm like, oh, that's pretty good. And it actually, because water is water. There's no taste to it. This has like strawberry and hibiscus, blackberry, and it's like, oh, it's good. Not as opposed to soda. It doesn't taste like super sweet like a fruit juice, but it just has a nice flavor to it. So okay. Plus you get a little bit of protein.
Gave up on sodas altogether.
Yeah, thank God.
Once in a blue moon, if we go out to dinner, which that doesn't get to happen anymore either, I might have a Diet Coke with my dinner once in a while. Other than that, we just have like iced tea or whatever. But for the most part, I've gotten rid of sodas. They're just terrible for you.
True. But I would consider taking out that taking out the potassium and see if we can get your sympathetic nervous system a bit. So the walking the tightrope for you is the blood pressure. So any and everything that you can do just to stay as calm and relaxed. I would even take a walk in the sunshine. That's kind of easy to do. Of course, you can't breathe. This is one time when I would advocate wearing a mask with all the fires and the smoke and soot and stuff in the air. But the sunshine on your skin will dilate blood vessels, and there's a whole bunch of other benefits to that. But it certainly will.
I spend a lot of time in the sun.
It'll lower your blood pressure
every day.
Okay.
I'm an outside guy.
Yeah.
When I get tired, I'll go sit down in the garage for a little bit, and then I go back outside to do something.
Mm-hmm.
I don't even like being indoors. I've just always been outdoors.
Nice. That's awesome.
Even in the winter. When we lived up north, my parents would come out at night and tell me, Gary, you have to come in the house.
Yeah.
So I just stay outside and play in the snow and do stuff, and they were always telling me, get in the house.
Yeah.
I don't want to be in the house. Should have been a forest ranger or something.
Probably so. Me too. I love being in the mountains. That's my thing. Boy. So in this case, on the food side, it says don't do soybeans. But the one exception is that soybean lecithin, because you're not getting the protein, the soy protein that's in there that's really bad for you. You're getting the essential fat that's going to fix your liver and blood fats, cholesterol, all that good stuff.
So regular meat fat won't bother me then?
No. No, fat never ever was the problem. And even the guy said this morning too, he says he could eat as much fat as he wants. That's not the problem. As long as it's good fat, is what he said. I'm like, yeah, that's what I say. So it's the stuff like, soda, sugar, starch, and I love that stuff too. I just don't want to do it. Don't want to end up having some issues. So what we'll do now, we'll take you out and throw the stuff on you and test you. And
so I just leave this stuff here, or?
Yeah, you can. Yeah, absolutely. I think.
Do you need to?
Hopefully not. I don't think so.
Bust somebody else up?
I don't think so. Let me hit print on these. Oh, that's right too.
Around a little.
Let me click on and stop your recording.